Hello and welcome to another wonderful episode here with us on SYNLAB Podcast. My name is Patsy Mokungah and I'm your host. It's said on average that every human will break at least 2 bones in their lifetime. But I find personally that we don't think about our bones on a day-to-day basis. You think about it maybe, when you're older, or if you have an older person in your life who has bone issues, or when you break a bone. However, we carry our skeletons everywhere with us, every single day of your life. And that's why we at SYNLAB Podcast thought it an important topic to discuss. And so today we'll be talking about our bones. And we've titled this series, Beyond the Skeleton, the Truth About Your Bones. I don't have much knowledge about bones or bone health, apart from the fact that I have a skeleton. So I have with me an expert here on bones, Dr. Olasode Israel Akinmokun. Welcome, sir.
Thank you for having me.
It's my pleasure to have you. But before we jump into our discussion on, this very important topic, I'd like to introduce you to our guests so that they have an idea. I told them that you're an expert. So I want them to know because I've read, I know. So I'm going to introduce him to you and I'm going to read his bio. It says here that Dr. Akinmokun is an associate professor in orthopedic surgery and a practicing trauma and orthopedic surgeon at Lagos University Teaching Hospital. That's LUT. He's based in Lagos, Nigeria. His clinical practice centers on general orthopedics. He manages trauma and degenerative conditions of the musculoskeletal system and is involved in public health education on prevention and management of various orthopedic conditions. As an associate professor, Dr. Akinmokun contributes to medical education and training of undergraduate and postgraduate students at UNILAG and resident doctors at LUT. He has been involved in various researches that cut across basic, clinical, and non-clinical aspects of orthopedics, with the aim of improving clinical outcomes and the practice of orthopedics. Dr. Akinmokun operates at the intersection of clinical practice, surgical training, and research. He is involved in both direct patient care in orthopedics and trauma and in shaping the next generation of surgeons at one of Nigeria's leading medical schools. I think I have convinced you and not confused you that he knows what we're about to talk about. Thank you once again, sir, for being here with us.
It's a pleasure.
Okay, so to jump right into our topic for today, we've already said we're going to be talking about bones. The first thing we want to talk about is the fact that bones are alive. That's not something, honestly, until I read the maybe the questions that we had for today, I don't think I've ever thought about bones as something that are alive. I feel like, to me, they're like wood.
Exactly.
Or metal.
Exactly.
So when I only think, yes, it's like when we talk about bones, like, oh, it's structure, but what else? What's there to know about bones?
Exactly. Because the truth of the matter is that most of us, when we're seeing bone, most of the bones we see are those ones that are lying all around. Mm-hmm. And they don't look alive at all. They look dead. And so most people don't know that bones are living organs.
I did not think about that.
So add that one to what you know now.
Okay.
Exactly. Yeah, exactly. Well, like I tell people every day, we'll learn every day.
Yes.
And so bone is, it's a living organ. And part of what bone actually, what it does in our body is that all the blood cells in our body are produced by bones.
Really?
Oh, yes. They are produced within the bones. And then also bones help us to maintain the calcium homeostasis in our body. There is an important element in our body called calcium. Calcium is very important in most of the activities that goes on in our body. All the contraction of muscles and the nerves and everything. Calcium is actually very well involved. Even the contraction of our heart. And so we need to maintain this level of calcium in our body. And these calciums are stored in the bones and they are released from the bones. And so a dead organ can't do that.
True.
And then also fat and energy are stored in our bone also.
Fat and energy?
Exactly. They are stored within the bone. The long bones actually store fat. And so if you go on fasting for a very long time, they can be released. And so, the bone is alive. They contain cells in the body that are living cells, really. And so beyond the structure that we see, beyond the dead bone that we get to see all around, bone within us are living.
Okay. We just had this podcast and I feel like I'm already mind blown because honestly, I've never thought about it this way. I've never known that the bone stores anything. I mean, yes, you're helping me connect dots in my head. Like, for instance, I know that all I know is that they've always said calcium is good for your bones, but not in the way you've explained it now, in saying that, the bone store calcium and, it helps with other aspects of our body. That's not something that my brain has ever been introduced to. I'm very happy to learn. I'm sure our audience, you people will have to be as amazed as I am because, wow. Okay. So I have a question here, which goes, what is bone remodeling and why should the average person care about it?
Yeah, thank you very much for that question. We need to understand something about the bone. The bone is a structure that tries to break down the old cells and build a new one.
Mm-hmm.
And that's what it does. And so that's what we call remodeling. It's a process. It's a process that happens within the bone in which the old bone cells are pulled down and the new ones are built. The bone tries to maintain itself so that it's able to maintain the architectural structure and to make sure that all the mechanical stress that we pull the bone through, activities we do as we walk around, as we carry things, they all have effect on the bone. And so the bone makes sure that at least those mechanical stresses do not put so much effect on the bone in such a way that the bone will be to the detriment of what is happening. And so all the old cells that have been in the bone tries to pull them down and build a new one. And that's what we call remodeling.
And this happens daily.
Every day. I mean, the bone is at work. Even when you are sleeping, you are working. Every time you're doing your activity, the bone also is doing its own activity. So be sure that your skeleton does what it's supposed to do appropriately.
That's interesting. Like, I've never thought about it that way because right now I'm picturing like we've said, a living organ, which is not something a picture I've ever had about bones in my life. I just thought that maybe, apart from the fact that maybe your bones grow as you grow, once it's there, it's just there and it just hangs there like a piece of wood.
No, bone is actually very spectacular.
And it makes sense because now I'm asking myself, how does the bone grow if it was not alive? So thank you. You're helping me think. I think that's what knowledge does to us. It helps us think better.
Exactly.
So my next question would be, at what stage in life do we build our strongest bones? And what happens after that?
Yeah. So how do I put it? So our strongest bone, which we call the peak bone mass, occur between ages 25 and 30 years.
Wow.
Yes. And so from when we get to the adolescence, the bone mass start to increase, and about 40 to 60% of bone mass are built around that period, and then continue to increase until when it gets to about 25 to 30 years, when the peak bone mass is established. And so we always tell people, don't wait until when you are old to say you want to build your bone. Then no, you are late already. If you have not started building your bone when you are younger, by the time you say you want to start building it after you're 30, you're late already, because the peak bone mass actually occurs at 30. After 30, what actually happens is that the building of bone peaks, and then the process, like we talk about remodeling, the process of remodeling is that the old bones are taken down and the new ones are formed. And then by the time we are 30, getting to 40, the process of building start lagging behind.
Oh, God.
And by the time you are 40, the process of building even lags more behind. And so if you have not reached the peak, I always say this, like just let's put it as an example. So if you are going to, okay, so let's just assume that you are going to retire at 30. If you have 10 million in your account at 30, and you're supposed to spend 100 naira in a day, you know that you'll be able to spend that money for a very long time.
Yeah.
Yes. But if you are retiring at 30 and you only have 10,000 naira, that means very soon
you're going to be
out of money. And so if you have not built appropriate bone mass by the time you are 30, the likelihood that you would suffer bone health by the time you are getting to your 60, 70 is going to be very, and the risk of fracture is higher. And so you need to make sure that you build your bone as early in life as possible.
This I'm thinking as you're talking. I hope time has not finished for all of
I know, don't worry. There is always a way out. We'll talk about the way out. So don't be bothered about that. Like I said, nature knows the way. Yes, there's always things that we can do to make sure that at least we don't lose out totally.
Okay, so is it possible for somebody to like start losing strength in your bones, but without knowing?
Oh yes, a lot of activities that actually happen in our bone. We don't know. We don't know when they're happening, because yes, we know there are nerves in the bone, but the process of remodeling that we talked about that makes a bone building and bone taking out, it's not something that gives symptoms or sign. And so most of the things that actually happen within the bone don't give symptoms, so you won't know. And that's the reason why a lot of people, by the time they're getting to know that they have issue with their bone health, probably maybe they have a fractures or something, or maybe incidentally they are part of people that go to check, they'll do some tests to check about their bone density, and they did not find out that, oh, that's an issue. Yeah, so usually people don't get to know. Really.
I don't think I like personally. I definitely do not think about my bone health or think like, oh, you should go and check your bones.
It's not only yourself. A lot of us actually don't think about our bone as, when we don't even think about bone as if it's a living organ already.
Yes, it's just
people talk so much about the breast, talk about the prostate, but they talk about a lot of organs in the body. But of course, also the bone is an organ in the body that needed to be monitored.
You see, that's the thing. I did biology, and it has never occurred to me that the bone is an organ. It's just a skeletal structure.
Well, unfortunately, also in the biology class, they give us dead bone. And so we look at it as if, it's a dead bone. Whereas they didn't tell us that it's a living organ, really.
This is such an important discussion. I'm very happy that I'm here and discussing it with you and getting to learn this, because it's bringing a lot of things alive in my head. So now when we talk about, we at the beginning of the podcast, I mentioned the fact that it's said that people break about 2 bones on average in their lifetime. Is this true? Because some of me like this, I've not broken a bone. So I'm thinking like, is it in my future?
Well, if you break your bone, I will treat you. And I will collect more money from you, because I can see that you are a very important person, VIP. But actually, it is not something that is true. But they say that really. And the importance of saying that is to make sure that people take care of themselves so that they don't break their bones, really. Yeah. And that's just what that statement is meant to do. You don't have to break your bone, please. You don't have to.
You don't have to break your bones, okay. But at least if we break our bones, we know that it can be helped.
Yeah.
Okay, so I think this is a very educative structure. When we were preparing for this podcast, before I got here, I had no idea that I would even learn. In my mind, I'm like, oh, okay, bones. At first, I even thought like, why didn't they give me a more interesting topic? And so, being here now and just starting off like this, I'm really, really excited, because I'm getting to learn so much about bones that I didn't know. I know that I'm going to walk away from here thinking, oh, differently about my. Off the bat, I'm already thinking like, oh, how am I building my bone structure? Or like, how can it get better? And I'm sure that our audience is also thinking the same thing. I know that you are learning as much as I'm learning. So sit down, we're coming back, to talk more about bones. But while we're on a break, I want you to like this podcast. I want you to subscribe to this podcast. I want you to share this podcast and leave comments. And see, because me, I'm amazed. If I was watching, I'd been leaving a comment like, I didn't know about this, or so I expect to hear from you people. You can do all of this on YouTube, on Spotify. I'll be right back with much more discussions about your bones. Thank you.